the webinar is on proton pump inhibitors, use and abuse. We have with us Dr. Manas Kumar Panigrahi, who is an interventional gastroenterologist and hepatologist. He is now working as an additional professor in AIMS Bhubaneswar. So I kindly want to start the topic. Kindly, sir, we can start.
Yes, please.
Sir, there are various questions about this topic. I want to have some questions we can discuss, sir.
Yes, please go ahead, Dr. Biswajit.
Sir, what are PPIs, sir? What are proton pump inhibitors and how they work? This is a common question, sir. What are actually PPIs?
So, am I audible, Dr. Biswajit?
Yes, sir. Yes, sir. You are clearly audible now.
Okay. Good evening, everyone. Thank you, Dr. Biswajit. Thank you, MSc team, for again inviting me and giving this opportunity. So there is some technical glitches. I could not able to join from this laptop. However, I can now able to join from mobile phone. Hopefully, I am visible and audible.
Sir.
And
Yes, sir.
this is a very common topic. And once again, thank you for inviting and discussing this sort of common topic in this forum where a lot of people are there, doctors, not only doctors, other people are also there. So it will be, hopefully it will be a nice discussion and we'll take home good points from this discussion. So as Dr. Biswajit has asked, what are PPIs? Can you again, Dr. Biswajit, can you again repeat that question?
Sir, what are PPIs and how they work in our body?
So again, PPI, if I'll tell, PPI is a short form, proton pump inhibitor. Proton pump inhibitor or PPI. And commonly, if I'll tell to our Indian scenario, PPI commonly misused as acid tablet or gas tablet. However, PPI are proton pump inhibitor, which covalently block the proton pump which is present in our parietal cells and which secrete acid, that is H plus ion, and convert HCl into our stomach. So basically, we require this acidic environment in our stomach to digest a lot of food and for our digestive process. So that is essential for this acidic environment is essential for a lot of digestive process. Also, this is preventive also from a lot of infection we can prevent due to this acidic environment in stomach. So again, basically, if I'll tell proton pump inhibitor, they used to block proton pump, that is H plus K plus ATPase which is present in parietal cell. So and in Indian scenario, we used to tell it as acid tablet or gas tablet, but they are proton pump inhibitor.
Sir, thank you. So now we want to know, sir, what are the commonly prescribed PPIs in India? Commonly prescribed PPIs.
So, if I will tell regarding PPI, journey of PPI, the first PPI which was developed in 1980s around, that is omeprazole, and before that we have S2 blocker was there, but this is omeprazole was the first PPI or proton pump inhibitor developed in 1980s around. Then lot of PPIs after that has been developed like omeprazole, pantoprazole, esomeprazole, rabiprazole, lansoprazole, dexlansoprazole. So these are the different PPI which has developed over this period. But omeprazole is the first PPI which are developed in 1980s, and recently this dexlansoprazole and different enantiomer of this PPI are being developed. And I will not tell that is PPI, that is PCAP inhibitor, potassium competitive acid blocker, that is Boniprajan, that is the latest one in the kit. No doubt that is not a PPI exactly. We cannot tell PPI, proton pump inhibitor. That is potassium channel inhibitor. This is so that is the latest one, and in the kit. Of course, it is not available in Indian scenario, Indian market nowadays. But hopefully, we'll get that Boniprajan also within a 2 to 3 months in time. We'll get that.
Sir, sir, from my inquisitiveness, I want to know, sir, there is a difference in mechanism action of omeprazole in the recently, like esomeprazole. There is a difference. Is there any difference in the mechanism of
So
action?
basically, if you'll see, all the proton pump inhibitors are proton pump inhibitor. These are variety of proton pump inhibitor, but their mechanism action is all are equal. They used to inhibit proton pump, which is present in the parietal cell. It is
Sir,
present inside the parietal cells. Once we activate, this proton pump comes into active form. They used to come to the surface of the secretory surface. Then this proton pump, which blocks, proton pump inhibitor blocks the this H plus K plus ATPase in the active phase, and thereby they act, that is the mechanism action of these PPIs.
sir.
And
Okay,
basically, all PPIs act in a similar fashion only. Their mechanism action is same only. Only difference between these PPI, if you'll see, uh, they metabolize this. All these PPI are metabolized by liver. Of course, all the drugs are metabolized by liver. There are few certain enzymes or CYP, cytochrome P450 enzymes, that is, two enzymes are there basically which are involved in this PPI metabolism, CYP2C19 and CYP3A4. These are two cytochrome enzymes which are involved in. Only difference in this PPI are few PPI are they metabolized by CYP2C19 and few others are by CYP3A4. Just like if I'll say the previous PPIs, which is first generation PPI, that is omeprazole and pantoprazole, they are metabolized by this 2C19 cytochrome 450, whereas this rabeprazole and lansoprazole group, they used to metabolize by these two, both of these CYP2C19 and 3A4. So that is the only difference between these PPI. However, their mechanism action, if you will tell, by inhibiting this proton pump, they used to have their effect.
sir. Okay, sir. What are the benefits of using PPI? What are the different benefits of using a PPI?
So hopefully, we every day, every prescription, if you'll see, there is a PPI. But this is an excellent question. What is the benefit? What is the indication or something where we should use PPI, or we should know? Everybody should know that, because no doubt it is available over the counter and everywhere, and every prescription you will see PPI. But there are certain indication where we can use PPI, and there are lot of indication there. Every prescription we used to see where PPI should not be used. So by indication, that is PPI previously what they they are discovered just to reduce this acid related disorder, or mostly, if I'll say, this is peptic ulcer disease. That is the most common indication of this proton pump inhibitor. Peptic ulcer disease means either it is duodenal ulcer or gastric ulcer. There are a whole lot of other indications are there, but this is the most common indication where this PPI are used. Other indications, just like if we'll say maltoma, H. pylori eradication, used to use PPI, erosive esophagitis, and Barrett's esophagus, eosinophilic esophagitis. Lot of whole gamut of indication, lot of indications are there where you can use PPI. As a PPI can be used as a treatment modality, it can be used as a preventive modality for GI bleed, where you are using additional, have somebody having risk factor and they are using this antiplatelet, anticoagulant. So we can use there also this PPI as a preventive modality. So there are a lot of indication where we can use PPI.
Okay, sir. What are the risk and side effects associated with long-term use of PPI?
So basically, there are before going to side effect of long-term use of PPI, I will tell uh, PPI, except few indication, PPI should not be used more than 8 weeks. That is 2 months. Everybody should remember that PPI, except few indication, PPI are used only for 2 months. Hardly 1 month, 1 to 2 months, maximum 2 months. Other few indications are there where we can use PPI for long-term therapy, just like Barrett's esophagus or severe esophagitis. There is a classification, Los Angeles classification of esophagitis is there, where grade C and grade D esophagitis used to tell. So that is severe esophagitis, where you can use Barrett's esophagus, severe esophagitis, peptic stricture, and this eosinophilic esophagitis, idiopathic pulmonary. There are few this sort of indication. Few, namely, I will name these 4 5 indication only, where you can use PPI for long term. However, other indication we should not use PPI for long term. That is more than 8 weeks. PPI is not advisable except these few indication. As you have mentioned, what are the side effects? No doubt, the evidence is low about the side effect of PPI. Still, nowadays, lot of literature, lot of data has come up. So, a lot of side effects of PPI are done. They are now. No doubt, level of evidence is low. So, just like if I will enumerate the side effects of PPI, a lot of infection used to happen with the long-term use of PPI, just like Salmonella, Campylobacter jejuni, then this Clostridium difficile infection, small intestinal bacterial overgrowth. So infection used to happen at times, acute interstitial nephritis, vitamin B12 deficiency, hypomagnesemia, iron deficiency, community acquired pneumonia. So, the bone decrease in bone mineral density and incidence of fracture used to be more. And there are at times this, if somebody has H. pylori positive and you are using this PPI without eradicating for long term, they can develop this intestinal metaplasia, atrophy, and at times malignancy also. So there are a whole gamut of side effect of PPI are there. So no doubt evidence is low. We consider this as safe, but without any indication, proper indication, we should not use PPI for long term.
Okay. Sir, what are the alternative treatment options for acute peptic diseases? Acid peptic
So
diseases.
So alternative treatment option. So till date, evidence is that PPI is the best form of therapy for this acid peptic disorder or peptic ulcer disease. Alternative treatment option out of this proton pump inhibitor are the, at times we can use this. No doubt, their efficacy is less. We can use S2 blocker, histamine blocker, and we can use this. Antacids preparation, that is the magnesium and yeah, preparation, antacid preparation we can use at times, but symptomatic relief. But out of these three, if I'll say, evidence is for this PPI is highest, and alternative form are this S2 blocker and this alginate preparation, magnesium and aluminum antacid preparation are there. We can use at times that, but evidence are low.
Okay, sir. Sir, can PPI interact with other medications?
So
Because how?
as I told, PPI used to metabolize through this liver cytochrome P-protein enzyme to mainly to this 2Y cytochrome P2C19 and this 3A4. So the lot of interaction used to happen, and there are few medication where it can decrease its absorption, and there are few medication it can this PPI can increase their absorption also. So, namely this catroconazole, digoxin, there are few this thyroxine, and all those things are there are this can interact. This PPI can interact with this medication. May interact by they are increasing their absorption at times and by decreasing their absorption at times because of this common pathway of their metabolism, that is cytochrome P450, 2CY19, and 3A4.
Sir, what is the time of taking PPI? As far as food is taking before food, after food, what is the means?
So basically, these PPI are pro-drug, and you have we they have to activate it before their action start. So most of the PPI, they our proton pump are activated. That is when we used to take any food. So then only they are activated, and this PPI will act then only. So best time of taking PPI is that is half an hour before first meal of the day. That is your breakfast or something. That is the best time. So if you are taking half an hour before, this PPI will go to your small intestine. From there, they will absorb. From after absorption, they will come into the secretory canals of this parietal cells, where this H plus maximum number of H plus K plus ATPs, that is proton pump, are activated, and at that time only they block this covalently block this proton pump. So the maximum benefit of this PPI you can get when we are taking this PPI half an hour before breakfast. If you are taking that, we will get the maximum benefit.
Okay, thank you, sir. Sir, PPI can be used in a OD dose or BD dose, or what is the dosage normally?
So basically, why we are using PPI, OD, or BD?
Sir,
This, if you'll see their um, action time of their T half and how long they used to work. All these PPI maximally they used to work for 14 to 16 hour, and they will cannot cover this 24-hour period. However, they block the PPI. All these PPI OD dose also they block uh, maximum number of proton pump, that is around 65 to 70% of the proton pump will be blocked, and we'll get our desired action. If somebody has this transient reflux or nocturnal reflux and all those things symptomatic at night also, we can at times uh, do it twice daily also to get the desired action. If somebody is not getting enough action with OD dose, so we have to give first OD dose, and if somebody is not having desired action, desired effect of that PPI, at times we can give it BD also. However, from the beginning, some GI bleed patient or those group, we used to give BD or this peptic stricture, severe esophagitis. From the beginning, you used to give BD dose to maximum benefit should be given to the patient. And
sir,
except this indication, other indication we used to give OD. And after once daily dose, if somebody is not getting benefit, at times we can combine it, double dose we can give.
sir. Sir, another my personal doubt, sir, how to combine sucral fat with PPI? So some acid peptic disorders are there,
So,
ulcer is there. How we actually, what
so
is the timing?
good question. That is a
Sir,
good question Basically, when
sir,
we used to read our pharmacology book, we used
sir.
to tell this after combining this PPI with this sucral fat used to their desired effect or mechanism will they used to what we used to call it
There's a
um, uh,
it makes a barrier like effect,
ah,
I think. Sucral fat,
and then
it's a
not barrier, sucral fat, he act like a barrier, act like a
uh,
surface coating agent.
surface coating.
However,
Yes.
if you surface coating agent, but however, if you will use PPI, when they used to get surface coating agent, when there is some uh, this acid is there, you will get a surface coating on the ulcer or erosions or something. But in place of PPI, that they will not act. They this acidity is not, the acidic environment is not there, and PPI will have this H plus is not there. They so the desired effect of sucralfate we will not get. That is the usual way of thinking, considering the metabolism, their mechanism of action of PPI and sucralfate. However, recently I came across a study where they have seen, no doubt that design of the study, their evidence, and in the journal which is published, it is not up to high standard, but they have seen that PPI versus PPI plus sucral fat had more benefit than PPI alone group in that study. However, we should take with a pinch of salt, because it is not published in a peer-reviewed and high impact journal. Uh, However, common practice we used to do when sometimes some people come with GI bleed, we used to combine PPI plus sucral fat to get a benefit. But if you'll see their mechanism action, that is purely, we should not combine both the modalities.
Okay. Okay, sir. Uh, so now coming to the means use of PPI in older population, sir. In elderly population, uh, how to use? Is it safe to use
So,
PPI in older
first
population
of
or
all,
no?
mm, so elderly population, if you'll see, again, first, that is, I will say, good clinical practice is that whenever there is indication, we have to give PPI only. Without indication, we should not prescribe a single dose of PPI. And in older population, that is a special population group, older population, they used to have a lot of comorbidities. They used to have this osteoporosis and all those things. They are on different kind of drugs they are on because of these comorbidities. So again, this older population, you have to judiciously choose this PPI, whether indication is there or not. If you are using PPI, their pill burden is used to increase because they are already in a lot of pills they are taking. By putting another pill, you are just increasing the pill burden. At the same time, not only pill burden, so drug-drug interaction may used to happen. So there are a lot of things are there. They are osteoporotic usually. So if somebody is osteoporotic, and as we know the long-term effect of API, then again decrease the bone mineral density. So chances of fracture and all those things are high. So you have to consider a lot of things. At times, they are increasing pill burden, they are increasing cost of the therapy, they are drug-drug interaction will be there, and desired action of the drug we may not achieve. And this community called pneumonia, they are interstitial nephritis, and this bone fracture, and all those things are there. So, if there is indication, definitely use it. If there is no indication, we should not use in this elderly population, or you have to think multiple times before using. Just write the indication and give a PPI. That will be the best practice in them.
Sir, if a patient is he has to take an NSAID, non-steroidal anti-inflammatory drugs, then it's a must to use PPI, or we can avoid it.
So basically, that is a common practice, Dr. Biswajit. People used to not only with non-steroidal anti-inflammatory drug, with steroid and everything. If you'll see antibiotic also is so. That's why I'm telling you, PPI people are using
Sir,
uh, each and every prescription. You will see a PPI. And recently, I'm fortunate enough to, in a group, we have published now Indian Society of Gastroenterology. We have published the use and misuse of PPI, use and abuse of PPI. That is a guideline we have
yes, sir.
published. And recently, again, a meta-analysis we have done about inappropriate use of PPI, and that is going to publish in the prestigious journal GOT. Regarding this NSET, I will tell everybody can have this publication that is published in Indian Journal of Gastroenterology. This guideline published by Indian Society of Gastroenterology, and it is published in Indian Journal of Gastroenterology. So regarding NSET, if you'll see. There is no evidence, there is no clear-cut evidence that if you are using NSAID, you have to give a PPI. It is not recommended. However, if you are using NSAID and a person have an additional risk factor, let's say, if I'll give you example, you are using NSAID to a person who had history of GI bleeding. So, if somebody has history of GI bleeding and you are using NSAID, then you can prescribe a PPI. But if there is no history of GI bleeding, somebody is not on anticoagulant, antiplatelet agent, and you are using NSAID for any sprain or for any indication, there is no role of this PPI. You should not add PPI if you are using NSAID without any additional risk factor somebody has. So clear cut, there is no role of adding PPI to any NSAID preparation unless there is an additional risk factor of a person. So I mean additional risk factor means somebody has previous history of GI bleeding, somebody has previous history of peptic ulcers, somebody has taking along with this NSAID taking this antiplatelet agent, anticoagulant, then of course we can add a PPI for short term when they are using NSAID. Otherwise, no. Clear cut no for adding or combining prescription of NSAID and PPI.
Uh, hello, Manu sir. Hello, sir.
Yes,
Good
yes,
evening.
please. Good evening.
Sir, I have a question.
Please.
Actually, one of my friends.
Please, Mr. Avilas, give your introduction first.
Yeah.
From where you are speaking.
Yes. Hi team. Hi sir. Hi all. So myself Avila sir.
Sir, it's a very good point. I will PPI in patients of, I think, you tell, Abhilash.
Hello, please.
You can ask the question. Hello. Hello, Abhilash. Hello.
No, I think
I think
this can be
there's some
taken
issue.
up later at the end of
Ah.
the session. No need to take questions right now, I think. After the end of the you can take
Yes.
questions.
Yes. Hello.
Yeah.
Yeah.
Okay. At the end of the session, we can take up questions. Okay. Okay. Sir, I want to know about the use of PPI in liver and kidney diseases.
Okay.
How
Then
much
sure.
how it is to use PPIs? Sir. Hello, sir. Am I audible?
So again, as I yes, you are audible. You are audible.
Sir.
So I got your
Sir,
question.
I want to know, sir, in liver, sir.
So I got your
In
question
liver
whether
diseases patient,
PPI we
sir.
can use in liver disease and kidney disease. So basically,
Sir.
pertinent question. So if you'll see this PPI used to cause acute interstitial nephritis. However, this evidence of acute interstitial nephritis is low. That's why if there is any indication, as we have discussed, there are indication of PPI. If there is any indication of PPI, we can use PPI in case of CKD also. And similarly, in liver disease patient also, if there is indication, clear-cut indication is there, we can use PPI. However, you have to know the risks at times. PPI, if you are using in CLD patient, chronic liver disease patient, chances of developing this SBP, spontaneous bacterial peritonitis, we used to tell, that is high at times. Chances of hepatic encephalopathy is high in this group of population. So in CKD, chronic kidney disease and chronic liver disease, these are vulnerable population. If there is clear-cut indication, use PPI. Otherwise, there are a lot of side effects like SBP, hepatic encephalopathy, acute intestinal nephritis. Chances is more. So we should use PPI in this condition judiciously. If there is clear-cut indication, definitely we can use PPI. No harm.
Okay, sir. Sir, there is a special group pregnancy, PPI in pregnancy. What is the safety in using PPI in pregnancy?
So again, I will say whatever the question, whatever things we are discussing here, everything we have mentioned in that guideline, we can everybody can go through that. That will be very much helpful. And to this specific question, pregnancy, I will say this pregnancy PPI are class C drug. So we can avoid this proton pump inhibitor in first trimester. However, in second and third trimester, if clear-cut indication is there, at times for short term you can use PPI. However, in first trimester, please avoid. As per our good clinical practice, please do not prescribe PPI in first trimester. At times you can use this S2 blocker. However, avoid PPI in first trimester. Second and third trimester, if indication is clear-cut indication is there, for short term you can use PPI.
Okay, sir. Sir, finally, I want to know what are the lifestyle modification to reduce the need for PPI, sir? What lifestyle modification will help reducing taking these drugs?
So basically, lifestyle modification, I will say, if there is indication, if somebody has duodenal ulcer, you have to give them PPI. Somebody has this erosive esophagitis, you have to give them PPI. But only thing is this lifestyle intervention, unnecessary indication of when people are taking this PPI as a placebo or something, this unnecessary indication we can reduce that. Something like lifestyle intervention, I will say, somebody has GERD. How this GERD used to happen? In which group of population this is prominent? If somebody is obese, chances of GERD will be more in that group. So by doing this lifestyle intervention, you can decrease the incidence of this GERD. If abdominal obesity is decreased, chances of regurgitation and chances of this esophagitis will decrease. And thereby we can decrease the burden of this PPI. And whatever PPI we are using, if you'll follow, recently this is accepted in this PPI inappropriate use in from our group, published, this will be published in next edition of God. If you'll see 60 to 70% worldwide, not only India. And India scenario is again, it is different. I will say it is more in India because PPI are available in over-the-counter drug. And everybody has a notion that I tell PPI, I told previously, PPI are the acid drug used for acid, drug used for gas, and everybody will come to you and tell डॉक्टर साहब मेरे को गैस है, डॉक्टर साहब मेरे को एसिड है. And after listening to that, everybody are writing a PPI to them. So this confusion between this gas, acid, and all those things. Second is our over-the-counter medication. It is available. That's why this misuse is high in Indian scenario. However, it is not this situation is not confined to India, all over the world. In that meta-analysis, what we have done, we have searched around 2,400 around article published paper regarding the use of PPI. Out of that, we have selected 79 studies. We have selected and we have screened that within that 79 studies, 20,000 population have taken this PPI. And we have seen in that around more than 70% of prescription of PPI are without any proper indication. You can imagine. So out of 100, more than 70% are without any indication or inappropriate use are there. So this target inappropriate use group, this lifestyle intervention, what we are discussing here, this inappropriate use group, we can decrease this inappropriate use in that group. So let's say I will tell somebody has this DGBI, that is a entity disorder of God-brain interaction. Somebody has issue with some stressor, anxiety, or depression somebody has, and they perceive abdominal complaint with them. Let's say pain abdomen, and a lot of complaint, abdominal burning sensation, abdominal complaint, incomplete evacuation, bloating complaint, all those things can happen with the DGBI. So where people are using this PPI for 15 years, 16 years, long term they are using unnecessarily. As I told, except few indications, this PPI should be used for 2 months only. So writing a proper indication is important. And if we are writing a proper indication, except those proper indication, if somebody is using PPI and somebody has DGBI, we will tell them to this lifestyle intervention, this some form of exercise, some form of yoga. You can tell those erosive groups, don't take water as soon as you are taking food, don't lie down after taking food. You can raise your head end of the bed, and all those things. A lot of intervention like cessation of smoking, cessation of alcohol, decreasing weight, all those. These are lifestyle intervention. If we'll do this lifestyle intervention, lot of time this misuse of PPI can be prevented. And this, as we told, this nowadays antibiotic resistant, like antibiotic stewardship we are telling. So this PPI stewardship should be done. How it can be done? By this lifestyle intervention, or this what we are discussing now, writing a proper indication of PPI, not using PPI where it is not indicated, using PPI appropriately for certain duration, not beyond that. So this can go a long way, and this PPI misuse can be, we can curtail that, we can decrease that.
Okay, sir. Sir, now we can take questions from the audience. It was a very nice deliberation by sir. Many concepts, my personal and what we have discussed, it was a very nice discussion. And I want to take over the questions. If any questions are there from the audience, they can ask to sir. Now,
Please, I'll be happy to take all the questions. Somebody, if the audience have.
any doubt, any questions from the audience?
Sir, good evening.
Good evening.
So am I audible?
Yes, you are audible. Please tell.
Sir, I am Srinivas Das from Bhubaneswar. I am not from a medical field.
Yes,
I'm
Srinivas, please.
almost retired engineer.
Or you are audible.
But
Kindly
my-
introduce
I am
yourself and
audible.
okay.
I am Srinivas Das from Bhubaneswar.
कौन तो सर
Though I am not from, हाँ वो मेडिकल फील्ड रू है,
कहंतु प्लीज
telecommunication engineer. Mo 1996 रे I was operated with jejunostomy and vagotomy.
Yes sir, you are audible.
हाँ जेजेनोस्टोमी और वेगाटोमी मोर दुटा ऑपरेशन हितला 96 रे ता आगरु 15 इयर्स 15 वर्ष मो बहुत सफर करथिली जो पेन स्टोमक पेन ये सब जिंस पई बहुत तरह मैलिना ब्लीडिंग भी प्राय मोर देन 300 400 टाइम्स हितला. सो आफ्टर दैट प्रॉब्लम तो विशेष है ही नहीं. तेबे सर मोर गोटे क्वेश्चन अछि जे वेगस नर्व रे हमरो हाइड्रोक्लोरिक एसिड सिक्रेशन रो कंट्रोल टा केमती हुए माने हम मु जदी माने एसिडिक फूड सावर फूड खाइबी तो एसिड बेसी झरिबो ना कम झरिबो
कोन सुनंतु वेगस नर्व दैट इज अगेन इंट्रिकेंसी एज ए ये से मेकानिज्म भीतर को अपन को बुझीबा पई कष्ट हबो. से वेगस नर्व कोन करे ना से हमर जो एसिड सिक्रेशन हुए तार डिफरेंट मेकानिज्म एक्शन अछि. हिस्टामिन आसिकी करिवो एसिटिल कोलिन वेगस नर्व रो एसिटिल कोलिन आसिकी करिवो तापरे सो बाय दैट प्रोसेस से माने स्टिमुलेट करिवे दिस हमर पेरिटल सेल रे जो प्रोटॉन पंप अछि स्टिमुलेट कले एसिड सिक्रेशन हुए. सो देयर इज क्वाइट डिफरेंट मेकानिज्म ऑफ एक्शन से भीतर को अपन को जिबा एज ए नॉन मेडिकल पर्सन मो चाहूनी से भीतर को अपन को नेबा पई बट अपन एग्जैक्टली व्हाट यू डू एंड टू नो कोन जानिबा को चाहू छथि अपन को तो वेगोटोमी हे गला इज आर यू सफरिंग फ्रॉम समथिंग नो.
हां नहीं सर
हां सोर फ्रूट कहिले ना. हां डेफिनेट कोनोसी फूड जे कोनोसी फूड खाइले हमर एसिड सिक्रेशन हेबो. जे कोनोसी फूड खाइले हमर दैट इज नॉट कन्फाइंड टू अपन को सोर फ्रूट हो कि स्वीट फ्रूट हो कि जहा फ्रूट हो जे कोनोसी फूड खांतु एसिड सिक्रेशन ता हेबो. एंड इट इज परसेप्शन दैट कि हमर हां एई फूड खाइले होची से फूड खाइले एसिडिटी होनी. हां किछि फूड खाइले कोन हुए somebody is sensitive to some food and say mo कहबा कथा if you are sensitive to that kind of food and you are having complaint after taking that food don't take that food.
सर माने जस्ट को कहउतले जे आउट ऑफ दिस कॉन्टेक्स्ट मोर जो माने धारणाटा टिके ध्यान दे कि के सुनिबे सर. हमर इंजीनियरिंग गोटे अछि क्लोज लूप कंट्रोल सिस्टम जे कौन से कंट्रोल जोड़ा कि ए सपोज मोर गोटे वोल्टेज स्टेबलाइजर आउटपुट वोल्टेज 220 वोल्ट कमी गला आउटपुट रो टिके सैंपल नै कि इनपुट टा को मु करेक्ट करे नेगेटिव वोल्टा बढ़ी गले कमी जाए कमी गले बढ़ा करा जाए तेबे जाई कि आई एम गेटिंग ए स्टेबल आउटपुट. तो मु को करथिली सर मते तो जते बेले एंटासिड आ खीर खाया पे तो 96 रो ता आगो कथा कहू प्रचुर खीर पिया पे खाली कहउतला खाइला माने टिके आराम लागे पुणी किंतु से 3-4 घंटा परे माय फील स्टार्टेड टू फील द पेन. तो मु को कहथिली सर जो 15 वर्ष परे जस्ट खटाटा का को न कहि के आचार तो जस्ट मु गिली नथिली किंतु पार्टी रे सफिशिएंट समय रखिली जो सालाइबा झरिला तो मोर धारणा थिला जे खटा जिंस देखिले जे सालाइबाटा बढ़ुची एसिड टा ऑटोमेटिकली कम झरुची जानिनी सेटा केसे आई कुड नेवर माने
एटा कम झरेनी एटा जोंटा सलाइवाटा आपन को गला गुटे प्रोटेक्टिव मेकानिज्म हेसरे बाइकार्बोनेट सिक्रेशन है कि सेटा टिके ताकू न्यूट्रलाइज करे. बट एसिड टा कम झरे ये झरे नुह आपन को जो कोनोसी खाद्य खाइले will go inside it से एसिड टा झरिबो बट देयर आर एसिड आसिले हमर किछि प्रोटेक्टिव मेकानिज्म भी थाए. सो जहा अपन कहिले ठीक कहिले इफ somebody बेसी सलाइवेशन होउची सेटा जाउची that at times अपन को रिलीफ दिए by this protective mechanism but exactly अपन कर जो इंजीनियरिंग थ्योरी टा लगैले भलो लगैले we can discuss that over तमने not over this forum. so बहुत लोकन बहुत क्वेश्चन थिबो but जोटा that is a protective mechanism no doubt जोटा म्यूकस सिक्रेशन हैला अपन को पार्टी रु गला ये कला of course bicarbonate आसी की ये करे.
Okay sir, we'll go to the next question. Anybody?
Dr. Biswajit.
ठीक है सर, थैंक यू सर. हाँ
Yes, Okay,
Hello.
Abhilash.
Yeah, hi.
Okay.
Yes.
सांगा भाई.
Hi, sir. This is Abhinav, sir. So actually, myself, yeah, I'm working as a software professional right now. So I got to know about Manas sir. So one of my friend and one of our doctor. So those two guys are guide me and give me this link. So yeah, my question is actually, sir. My age is current age is 30. So since last 5 years, I am using PPI medicine, that is levosulfide, that is Esomac L. So since last 5 years, I am continuously using regularly. matlab, Regularly, I'm taking those medicine. So still, I am not without the, if I will not take in one day, na, then I am suffering from acidity, high acidity. So and last 1 year, I am also suffering from fatty liver. I don't know due to that medicine or something else. So kindly guide me. What is the next step? What should I do? Like,
A great question, Abhilash. We have not discussed, we have not touched upon this, how to prevent this misuse. Of course, you are misusing this PPI since you are using this for last 5 years. You are misusing. Unless I have told you, na, few indication are there where can you use beyond 2 months or so. If you are using beyond 2 months, except those indication, you are misusing this drug. So there are certain strategy. First, will answer first question whether it is first you are misusing one and whether it will cause fatty liver or not. If you are using PPI for long term, uh, chances that you can get this is not established yet, but I can say that chances that your metabolic, your intestinal gut microbiome will change, then they can lead to leaky gut kind of thing, and they can cause fatty liver also. So this is not established. However, I am hypothesizing that, and fatty liver can cause in long-term use of PPI in population. Not direct link is there, but however, this fatty liver is not the result of only one single thing. Lot of things that used to happen, but it is a one link. This can be a one link. Since you are using for long term, again, one thing we have not discussed here, there is no use of combination of this drug. You will see in Indian scenario only this Esomec, L, Pentoside, L, all those things are there. We should not use all those combination preparation. Combination preparation is we should use very judiciously. Use PPI only. And this whatever L or IT or something you used to do D, IT, L, all those things are prokinetic. We should not combine. We can this combo preparation, whatever Pentoside L, Esomac L, all those things. At time we need levosulfide, domperidone, or etopride. We can give separately without combining, so that unnecessary use can be decreased. And regarding your 5 years use, and you are having symptoms if you are not taking one day PPI also. So you are a software engineer, everybody can understand this. If you put a pressure on spring for long term, and if you are taking out that pressure, what will happen? The spring will bounce back, na?
yes, yes, yes.
So if you are putting, you are inhibiting that proton form for long term,
Mhm.
and if you are stopping that medication for few days, what will happen? There will be rebound acidity will there. It will not harm you a lot, but this discomfort will be there. Whatever discomfort you are giving after stopping this PPI for few days, na, that is a rebound effect. But that is not harmful. There are a lot of strategy to decrease this long-term use of PPI. This misuse we can decrease by, there are certain strategies are there. And those strategy, if you'll see, you can decrease alternate day therapy you can take. First of all, you stop this Esomac L kind of thing. take Esomec for few days, then take it alternate day, then take it once in a week or so, then you can stop it and you can take SOS as and when required. This is one strategy. Another strategy, you will feel discomfort, will stop at a time this medication, abruptly stop this. If you are feeling discomfort at times, you can use this antacid preparation at times for symptomatic relief. However, if you'll say, Abhilash, it will not going to harm this discomfort or something you are telling now. So again, here comes the role of lifestyle modification. You have to know what is happening to you, what disease you are suffering from. Without knowing the disease, without knowing the thing, taking this medication for 5 years, 10 years is absolutely not recommended. So I will suggest, I will not explain everything here in this forum. So a lot of people have a lot of doubts. You should visit a person, qualified person. You should discuss your problem and all those things, and you should get rid of this long-term use. Unnecessary, you can afford a medication that doesn't mean you will take that medication. You can afford Esomec L for 1 month. That doesn't mean you will take that medication for a whole lot of time. Hope I will.
Okay, sir.
Yeah, Dr. Biswajit.
Abhilash?
Sir,
Yes, yes, yes. Thank you,
Ah.
sir. Thank you, sir. I got.
Sir,
I got your
sir,
point.
more of the question. With us, our Dr. Tarun Mandal, one of the founder member of MSc since 1977, is present with us. He is also a former member of Parliamentary Standing Committee on Health. On this occasion, I want Dr. Tarun Mandal to tell a few lines on this rampant use of PPI. Dr. Tarun Mandal, sir.
Thank you very much for giving
Yes, sir.
attention to me. I am grateful, particularly listening this seminar, which is so vast a problem in this country. And it seems to me, after listening this seminar, very fruitful, very useful, even to me, and that lots of potent palm inhibitors and so-called over-the-counter antacids are used not as per indications, and this is a huge business indeed in the whole nation. And there are lots of side effects, toxic effects, and uncalled for effects for these drugs also. Particularly, I was listening of the older people, which has given me a lot of knowledge also today. I should definitely express my gratitude to Sir, who was nicely and so clearly in simple languages has explained many things about the use, indications, misuse, proper utilization, etc. of this drug, and along with the conduction of Biswajit, our beloved Biswajit, and the questionnaires also. And nowadays, the issue in the whole Indian subcontinent is this electoral bond, particularly given by the medicine companies, most vastly known companies who made various kinds of drugs and even the over-the-counter drugs and very essential life-saving drugs also, including that in the last pandemic, which we got, Covishield immunization, etc. And the thing is that that not to hide to their taxations or over income, anything, just to pass their products, which was rather stopped or not passed by the FDAs of different provinces, like that of Maharashtra, like that of Bihar also. After that, the attention of the government came down to them, those companies, the manufacturers of the drugs. And finally, they managed with the government with giving huge lots of money, around 1,000 crores of money has been given as an electoral bond by around 35 companies or more. So these are what should I call? Not only they are inflating the electioneering or other funds of these parties, political parties, but also they're injuring the health, peace, and the well-being of crores of peoples of our country. That cannot be accepted, or that cannot be rather passed away without protesting against it from the part of the medical fraternity. That role definitely are being played by medical service center, including that of Odisha MSc, including our All India MSc. So this is the point regarding the public health sector, which through these kinds of medical education, CMEs, continuing medical educations, and along with that, availability of drugs, its qualities, its curiosity, etc., including its so much prices, costs, which has been being decided every year by the Indian pricing authorities, drug price authorities. That is also not pro-people and really favoring the manufacturers, and in other way, ultimately to the different political parties, etc. That should not happen in the medical sector. And we know that in different medical entities, around even 5,000, 4,000, 6,000 percentage of profits they make. That is also should be stopped by any sort of civilized, beneficial, pro-people government of the country, cutting across any political party line. That is not our business to deal over here. But for to keep up the interest of the people's health, who should be the a prime lookout of any physicians, any doctors, any medical caregivers or provider, there should be the priority and key ambitions and aims of life along with its medical professional practice. So that should be a concern to us. And I hope and believe that all of our colleagues and pro-people physicians, highly educated and qualified medical individuals must feel, and they already feel, for our population, for their well-being, and they should stand up, will rise to the occasion to fight anything anti-people regarding health, drugs, medicines, overuse, extra use, over-the-counter use, etc. Whenever they will see it in our within our population or in our market. I am very much thankful to you again for giving me the scope of pushing some words before you. It may not be totally suitable with the subjects, academic subject which you are pondering over, but definitely in according to the need of the public health, it may put some light to it. Thank you very much for giving me the scope of giving such few words. Thank you.
So, great words, Tarun sir. But
Yes,
only
sir.
issue is here in Indian setting, if I'll say, we have taken our initiative as a society to increase the awareness, preventing these things. But without policy makers, this is unable to. Will increase awareness among doctors' population. Will increase awareness among this public. But how much will do without substantial policy making? Let's say decreasing the over-the-counter drugs without prescription. Somebody should not take that without giving this license to all those 300, 600, 500 companies. Only those who are quality making company, they should give that. Without that, it is not going to change. However, we'll try our best to increase the awareness and decrease the misuse of this. Not only PPI,
I
everything.
fully subscribe your views, sir. I fully with your views. Absolutely, you are correct in saying such things. I fully
Sir.
subscribe your views, sir.
Sir, thank you, Tarun sir, for your deliberation. It was really nice to listen from you. And actually, the time we are crossing the time. It is more than 10 now, and I think one to two questions more we can take. Any questions? Then anybody can ask.
Hello, sir.
Please.
Good evening.
Maximum 2 questions.
Sir,
Hello.
I am
Yeah.
Sumit from Jagatsinghpur. I am a paramedical staff, sir.
Kindly introduce and ask the question.
Yes, sir. I am Sumit Sahu from Jagatsinghpur. I am a paramedical staff nurse, sir.
Yes, please.
Sir, I have a question.
Yes.
Yes, sir.
You are
Sir,
audible.
is it compulsory to give PPI with antibiotics? I see all doctor always prescribe PPI with antibiotics.
Nice question, Sumit. So, as I told, with NSAID, with antibiotics, with probiotic, with SSRI, lot of times we used to co-prescribe PPI, but it is not mandatory. Not mandatory. It is not. It is not indicated. If somebody is prescribing with antibiotic, we should tell that this is not indicated. We should aware ourselves and our colleague also. It is not mandatory to co-prescribe PPI with antibiotic. It is not mandatory to co-prescribe PPI with NSAID. It is not mandatory to co-prescribe PPI with probiotic, SSRIs, with this antiplatelet, anticoagulant, unless any additional risk factor is there. And we have discussed what is additional risk factor.
Thank you, sir.
Okay, sir. Then the next question, if any.
Sir, I'm a pediatric resident from Assam. I wanted to know that if I need to prescribe PPI and iron preparation, genuine indications for both conditions in a single patient, is there any specific advice that I should give about the consumption of these two drugs together? Because the absorption may be hampered for the iron preparation.
Great question. I don't know your name, but it is a great question.
I'm Dr. Shruti, sir, from Assam.
Dr. Shruti. So, if both genuine indication is same patient is there is very little bit low evidence is there that PPI will decrease the absorption of iron is there. And if genuine indication is there, you have to give PPI in those patients. And seriously, if some person is again iron deficiency, I will suggest to give iron infusion now. Safer iron infusions are now available. Give PPI and give iron infusion also. So that is a better alternative I will suggest. However, we can co-prescribe this PPI and iron at a time, but absorption will be a hamper, which is again low evidence is there that iron absorption will hampered by use of PPI. But if genuine indication is there in the same patient, I will suggest you to go ahead with PPI standard dose and give iron infusion. At the safer forms are now available. Plenty of brands are now available. They are safe. We can iron infuse them at a time, and we can have our desired effect of iron also and PPI also.
Right,
I hope I am
right,
clear.
Yes, sir. I get it, sir. So actually, I deal only with pediatric population, and like in my hospital, I have not seen them give the iron intravenous preparations of iron. But if I have to give oral, like if I need to give oral, like there is no like gapping that should be maintained, right? There's no such particular guideline about gapping between the doses or something.
There is no such guideline, and combination
Right.
also. If you'll see now, there is whatever papers are there, they are having very low evidence. What
Low
are the
evidence, okay.
side effect? Why there is just think why there is so much rampant use of PPI there? Because these are safer drug. Now
Yes.
after this development of PPI in 1980s, after 40 till 20 years there is no issues. After 20 years, some paper came ki there is misuse or rampant use there. Now after using this 40-45 years down the line, still now you are coming up with a lot of paper having misuse, side effects and all those things. And that are having again low grade of
Right.
evidence. Not
Right.
directly cause and effect relationship we have not established yet. So that's why
Okay.
this rampant or misuse is there. So regarding this vitamin B12 and iron absorption, there is a little bit more evidence for vitamin, stronger evidence is for vitamin B12 absorption is there. However, for
Right.
iron, it is a little bit weaker is there. We can
Okay.
co-prescribe, no doubt. We can co-prescribe iron and PPI and we can get the action. The evidence which is there, absorption of iron is so very weak evidence is there. So there is no harm in co-prescribing in
Right.
pediatric
Thank you.
population also.
Thank you. Thank you.
Any last question, because we are out of time now and we should wind up. It is already past 10. And any last doubt like we can take?
Asutosh, last question, Asutosh
Uh,
Pati
uh.
has raised his hand.
Excuse me, sir. Am I Excuse me, sir. Am I audible?
Yes,
Yes,
you are
now you are
audible.
audible.
Myself, Asutosh Pati, final year student at Hospital Medical College and Hospital Baleshwar. Sir, who used to visit the clinical postings, and in the clinical postings, we used to visit OPDs of medicine. And some patients come and he has gastritis before, and requesting, sir, please give medicines, and along with some, like they were saying in their language, sir, let's give me some pani also, etc. And sir, please give me some divols. Sir was giving him PPIs, and in addition to that, sir also gave him the aluminum hydroxide and magnesium hydroxide, magnesium hydroxide composition. So my question is, will it be beneficial or any harmful effects of it?
So, nice question, Asutosh, and nice observation you have done. But only issue is that if somebody is taking for this, what you utter now, this gastritis,
Yes, sir.
used term in this medical science. Uh, and there is no such term.
Yes.
If you'll see there's indication of PPI, you will not come across this gastritis. At times, this erosive gastritis and hemorrhagic gastritis, all those terminologies are there. But this loosely coined gastritis term and using PPI is again that is a not proper indication, I will say. But let's say you are using PPI for certain duration for those gastritis, whatever you are telling those gastritis now, only PPI will suffice. Only PPI for 4 weeks will suffice. If there is no red sign, nothing, you can uninvestigated, you can give PPI for 4 weeks and not more than that. And for this combining PPI with antacid preparation and all those dibal and all those preparation are not evidence based, I will tell, not justified. Somebody, if you are using PPI for certain duration, after using PPI, if you want to stop that and stopping, somebody is having some discomfort or something like that, during that time you can tell that ki, stop PPI, you have taken for enough duration. Now, if you are suffering from something, other form, try to investigate what exactly the person is suffering from. That is first thing. If still symptomatic, want to give relief to that person, you can use this preparation, this antacid preparation at times, SOS, you can use that. Combining both the things are not a proper medicine, I will tell. That is not evidence-based medicine. I hope I am clear, Asutosh.
Thank you so much, sir. I'm also clear. Thank you, sir.
Okay, now
Dr.
we are in the
Vishwajit,
last.
time
Okay.
is too late. Still,
Yes, sir.
still a
Uh,
request to a last request. Our senior most member, who is always present, Mr. Swadhin Patnaik, sir. He has raised his hand for if he wants to tell something, ask something, then sir, Swadhin Patnaik, sir. Last. Here we will conclude. Sir, Swadhin Patnaik, sir, do you want to tell something? You had raised your hand, sir. Do you want to ask something, sir?
Sir is muted.
Sir, Sir, unmute yourself, sir. Sir, please, you are muted. Sir, your phone is mute. Sir, please unmute yourself. Swadhin, sir, please unmute yourself. Sorry, sir. Swadhin, sir, are we audible to you? Okay. Sorry, I hope it is not audible to sir or. Dr. Vishwajit, conclude. Okay. Oh, so sir, say or something. by mistake, perhaps.
By mistake.
Yes, yes. By mistake is said. Okay. Dr. Biswajit, now conclude. Yes, Dr. Biswajit, conclude. Am I audible, Dr. Biswajit?
Hello.
Dr. Biswajit, conclude now.
Thank you, sir, for your nice discussion. We learnt a lot from this.
Call for vote of thanks.
Now I want to call for the vote of thanks to Mr. Asutosh Pati. He is a final year MBBS student. Asutosh? Hello?
Yes, sir. Yes, sir.
Vote of
Thank
thanks.
you, sir. Thank you, Dr. Dr. Biswas, sir, for inviting me to give a vote of thanks. A very good evening to everyone. Myself, Asutosh Pati, a final year MBBS student at Fakima Medical College and Hospital, Balasore. I am extremely delighted to give the vote of thanks for today's webinar, sir. The topic of today's webinar was about the use and misuse of PPIs. It was a much concerned topic of today's era. Everyone should much aware about it, and that was very beautiful and elaborately presented by our respected sir, Professor Dr. Manas Kumar Panigrahi, sir. As a great person indeed, he is very well known as an interventional gastroenterologist and international gastroenterologist as well. Fortunately, we are now cleared about this great threat and can understand different cases where and whom we should prescribe the PPIs. This webinar was quite different and question answer based approach, which was very essential for us as we are the boarding doctors. Thank you so much, sir, for your presentation. I'm heartily thankful to you for sharing these great experiences about the most concerned topics, sir. I also like to thank today's Dr. Vijay Mahapatra, sir, working as assistant professor in Department of Urology of MKCG Medical College and Hospital, Barampur. Sir, I would like to thank a lot, sir, for this necessarily important questions which have already cleared all our queries.
Okay, thank you.
Lastly, I also want to appraise the huge aspect and obligation to the respected seniors participants and for a great presence and coordination in making the webinar more associative and successful as well. Thank you everyone for your questions and making it a discussion approach for starting to the ending also. Thank you so much, sir. Hereby I end the vote of thanks from my side. Thank you very much again.
Thank you, Asutosh.
Thank you very much. Thank you very much, Asutosh, Dr. Biswajit. Thank you very much.
Thank you, sir. Thank you. Sir, now we can conclude, sir. We are concluding. Thank you.
Thank you. Bye bye.
Okay. Thank you. Thank you, sir. Good night.
Thank you, sir.
Good night,
Good night, sir.
Thank you. Thank you. Good night to all.